Hey there, everybody. I am popping in again with Allison this time. I hope that you have found out already that we had been talking about heart failure all this week. I had posted a video earlier in the week about heart failure and exercise, and now we wanted to come and talk to you a little bit about the speech therapist perspective on heart failure and different things that may come up that they could really help this population with. So if anybody didn't know, Allison is a speech language pathologist. So I brought her in on the discussion so that we can kind of hear all aspects of care that these patients may need. Heart failure is something that comes up all the time with physical therapists and occupational therapists. It's somebody that we just treat all the time. And in a portion of our heart failure webinar, we go into some of those less known risk factors that are associated with heart failure, one being sleep apnea and the other being anemia. So surprisingly, of the patients who have heart failure, 1/3 of them also have anemia. And then of those patients that have both of those things going on, they are greater than 4 times more likely to have cognitive impairment compared to the patients with heart failure who don't have anemia. So I, just wanted to bring Allison in on the conversation and kind of see where she's coming from with, the whole screening process of these patients, how they would get involved, what kinds of things that they would, focus in on with that group of people.
So Ruth, with heart failure, unfortunately, as a speech and language pathologist, we don't get a lot of education about this in school. So
Yeah.
A lot of the things that I have learned or kind of accrued as time went on has been on the job and from my PTs, OTs, and from my nurses.
Right.
So as a speech and language pathologist, it's important that we make sure that we're not narrowing our scope or our patient population. Just because somebody doesn't have a neurological impairment doesn't exclude them from needing our services, which is something, like, again, I feel like you learn as you start working.
Yeah.
Heart failure is a chronic condition, as we know, and the rate of rehospitalizations is huge. So, something that we need to consider is, are these patients getting all of the therapy that they need? And do they have access to our services if needed? So Ruth, what is something you may refer to speech for if in a patient with heart failure something you see during your assessment?
Yeah, something that we often see, because the patients are usually either on multiple medications already or they're being put on new medications and things like that. I may notice, but more importantly, the occupational therapists might notice as they're going through their assessments that they're just not able to manage their medications. They're not able to, remember like all of the safety aspects of their daily life, things like that. Whereas we wouldn't necessarily always predict that we would see those things. So if we find that we're seeing that in these patients, then we would want a more comprehensive assessment done by you guys.
Right. And it's important too that not only occupational therapists are looking at a patient's safety, problem solving, organization, and sequencing, but physical therapy as well. I know it may not be as apparent for you guys during your assessments, but it's important you take note of how they're transferring. Are they able to carry over the technique that you're teaching them? Are they able to sequence using a walker if that's new for them? Adding all these assistive devices are all fine and good, but are they able to use them? Are they able to use them safely, which is always a challenge? And, with OT, they can look at, the more nitty gritty of somebody's IADL, such as medication management. Now, unfortunately, we know that these patients are usually on a laundry list of meds that are probably not easy to keep up with. So as a speech and language pathologist, I'm going to say we collectively for the field, we can help that patient come up with a system and problem solve managing all of these existing and new medications.
Yeah.
Also, it may be time for somebody to step in a system, which is something that as we get older, people are not receptive to. However, if you have it coming from a professional like ourselves, patients are going to be maybe more receptive to those suggestions than they would have been from a family member.
Yeah, And something that, all these things we would maybe just notice throughout our own assessments, just through our treatments. We might not notice it the first time or the second time, but we might notice it, start to become a pattern as we become more familiar with the patients. But something that I found really useful in my practice is the use of a cognitive screening tool, even as a physical therapist. We don't always think of ourselves as being able to treat or incorporate cognition into our daily practice, but it's really important. So something that I found useful is using the BCAT short form to kind of direct, where I might refer those cognitive needs, whether it be a speech therapist or an OT. So I don't know, like from your perspective, what might be most useful for those PTs and OTs to be using as a screening tool, or, different things like that.
So as far as formal screening tools go, I am honestly more of a fan of watching somebody in their functional activities. And the only limitations that I've found with screening tools are that somebody may be able to do really, really well, what I call tabletop, right? Meaning the door shut or in the room just with you. But then when you add all of these extra distractions and environmental things in, that they may not do as well. So honestly, this is where, even if you see somebody kind of do something unsafe during your assessment, or you start to notice poor carryover, is when to make the referral, and then we can kind of do our own comprehensive assessment. As far as formal screening tools go, that's something that you'll have to talk with your team about. But I know when I'm working with my therapy team, I kind of screen all of our patients informally. I look at their charts. And also our nursing department where I work uses the BIMS, which is the brief inventory of mental status. And there's a bunch of different things in there too that can be helpful. So, it's just something that you need to talk with your team about, and remember that if you guys are an interdisciplinary team, and just because somebody didn't have trouble with you doesn't mean they don't need to be referred for other services.
Yeah. And I find it, good too, to not only limit like co-treatment to one specific patient population either. Like, I know that in your practice, you do a lot of that with the brain injured population, but, kind of branching out and having it more tailored to what those patients with heart failure's specific needs are could be useful too. So getting, the PT might not be the most comfortable with identifying those needs or, anything like that, it might be a good idea to, jump in on their treatment and say, hey, this is where you would look. This is where you would identify these things. So, do you have any other suggestions about how you can kind of work as a team during one session, for the heart failure population specifically?
So when it comes to speech and PT co-treating, it is a little bit some uncharted territory for a lot of therapists, which is unfortunate, because I find it so incredibly fun to work with my colleagues and see what they're working on. So I would say the first step in planning or in executing a PT-ST co-treat would be sitting down with your PT and planning, looking at what the patient is having difficulty with during both of your sessions, and then trying to marry those two things together. So for example, let's say the patient is more of a visual learner and doesn't do well with auditory directions. Working with the PT on incorporating ways to visually cue that patient instead of just giving verbal cues would be a really great use of your time. Also, empowering your PTs to utilize something such as a memory book during your sessions, where maybe there are the steps to that task written down, or even some visual pictures. Like I said, I'm a very visual learner. I like to see it. I like to know what I'm doing. If you just tell me things over and over again, it's not necessarily very effective. So I would not be a great PT patient with just verbal cues trying to learn how to use a walker, So I would say sitting down and planning what you want to accomplish is the number one thing. You need to identify what the patient's having difficulty with, and identify what is going to prevent them from going home and being as independent as possible. Because not everybody wants to be reliant on others, and not everybody has a support system that is able to do those things for and with them.
Sure.
So I would say that is my number one tip. And you need to build those bonds and form those relationships with your coworkers. We are not islands. We are a team.
Yeah.
And I feel like sometimes, we can all forget that and we all get wrapped up in what we want to be doing when really we need to take a step back and look at the bigger picture.
Yeah, and I think it's well worth the time as well, because I know a lot of people are
Oh,
going to be listening
absolutely.
to this and say, well, I don't have time to do that. I just gotta, I've got to treat all these patients and I have to, get on to the next thing. But with any population, and especially a population that we're not necessarily meeting all their needs now because we're not aware of them, it's well
Right.
worth the time spent, to
Yeah,
get in the habit of talking to your coworkers and the other disciplines involved. And, then it becomes more streamlined, it becomes more easy, it flows better, and it doesn't take up so much, of what you perceive as too much time, so it's definitely well
absolutely.
worth
Yeah.
it.
And talking with your team members and your directors of therapy or whoever's in charge of your scheduling, maybe distributing minutes a little bit differently a couple days
Yeah,
would be helpful. Maybe like PT doesn't get as many minutes one day and ST gets the bulk of the minutes, because as a team, you guys have identified that medication management is going to be a huge issue, but that patient's also having a lot of difficulty with ADLs. So that necessarily wouldn't be a great thing for OT to take a break and work on, because
right.
they have more functional, ADL, shower, getting ready, using the bathroom type things to do with them. So you need to talk to each other. That's kind of the theme of my tips here. I don't know if you've noticed, but you need to talk to each other and figure out what's going to be best for that patient, and not just what you have in your mind that day,
Yeah, yeah. No, it's good advice for sure. And are
Yeah.
there any other, like correlations or different things that you've noticed about heart failure in relation to the speech therapy world?
So when we look at something like heart failure, particularly congestive heart failure and other respiratory related things such as COPD, there is a dysphagia or swallowing component a lot. And there's a lot of great literature coming out currently about, respiratory muscle strength training and things like that, specifically for speech and language pathologists. So,
That's great.
when we talk about levels of activity tolerance and endurance, that is also something that we can get in on. But that's a whole other round table of discussion, honestly, because we could talk about that. But I know for me personally, in order to improve my clinical practice, I am looking into completing that training virtually now. It has just recently been launched virtually. So if you have more questions about that, or how I plan on using that in my practice, you can email me at allison@arcseminars.net, and I would be more than happy to have that discussion with you.
That's great. That's great. All right, folks. Well, we're going to wrap it up there. If you want to scroll back through our Facebook page and see what else we had posted about heart failure this week, that would be awesome. And like Allison said, just shoot us any questions that you have about anything related to heart failure or otherwise. And you can visit our website, arcseminars.net, check out the heart failure webinar and any others that we have posted up there. All right. Talk to you later.
Thanks for tuning in.